Hello, this is Dr. Babak Larian. I'm here to talk to you today about parotidectomy and reconstruction. I had a patient by the name of Ibrahim from the Mauritius, I believe, who had a question about the reconstruction and the reasoning and how all of this is done. So let me first explain why the parotidectomy procedure and how the reason for doing a reconstruction. Okay, so let me turn that around. So this here is the parotid gland, of course. The parotid gland is in a very strategic location because the facial nerve, which is right here, let me bring this video to a stop. The facial nerve in the skull does a turn and a second turn and exits the skull right underneath the ear through a little hole. Excuse me. And then once it enters the parotid gland, it divides into two branches. The lower branch, which goes to the muscles of the neck and lower lip. Upper branch goes to the smile, upper lip muscles, eye, and forehead, right? So when you do a cross-section of the parotid gland here, what you have is a gland that looks like this. The facial nerve is at that point in the deepermost portion of it, with 1/5 of the gland deep to the facial nerve and 4/5 superficial to the facial nerve. And this is the reason why a majority of tumors in the parotid gland are superficial to this nerve, because there's more real estate, there's more area for a tumor to grow. Superficial to the nerve rather than deep, okay? Now, on top of the parotid gland is a layer called the parotid fascia, the covering of the parotid gland. It's also called SMAS layer. This is the layer that starts from here and goes all the way to the front of the face, right? And this is the layer of tissue the plastic surgeons use to do a facelift. So this is a very strong layer. On top of that strong layer is the skin, right? Which covers that area, right? All of this is really important. Now, in addition to the facial nerve there are other nerves that come from deep inside that go and tell the parotid to produce saliva. So whenever you get hungry, these nerve branches tell the parotid to produce saliva. So if you develop a tumor in this area, so let's say the tumor is here, and you try to take out the tumor, all right? And you get a little cuff of normal parotid tissue so that you make sure you've gotten the tiny little legs that a tumor may have. That way, the tumor doesn't come back, right? So when you do that, and you've taken this portion away, so now let's make this portion look. So this is now gone, right? This space is removed, right? But what you have now is these nerves that were here, they're coming right to the edge. They used to go to the parotid gland that was here to tell it to produce saliva. In most cases, when people do a parotidectomy, when they remove this layer, they also remove the covering of the parotid along with it, right? So all of that is gone. So now, if you were to reconstruct this again, now what you have is the parotid gland that looks like this, right? That fascia which only comes to here, right? You have the facial nerve deep in there. You have now these nerve branches that came and instructed the parotid to produce saliva coming to the edge. And if you don't do a reconstruction and you lay the skin down like this, in time these nerve branches grow into the skin, right? And attach to the sweat glands. And when they do that, every time the person eats, not only do they produce saliva in here, they also produce sweat. So the person's face would sweat every time they are hungry or they're eating. That's called gustatory sweating. So not only if you don't do a reconstruction, the person's face will have a divot, an indentation like this. They also will have sweating with eating, with hunger, any of those things, which can be very disturbing. Every time you eat, you need to get a rag and put it on your face to prevent yourself from pouring down sweat on the side of your face, exclusively just in this area where surgery was done, right? And that is very difficult to deal with. But it's something that can be very simply prevented and corrected. So, again, what we do when we do our micro-Parotidectomy is we not only remove the tumor and a bit of normal tissue, but and again, you have the facial nerve here, the tumor that was removed, the green nerve branches that are going everywhere. But because we leave the SMAS layer and skin over it, what we can do is we use a portion of the muscle, this muscle that sits on the side of the neck, and it's a thick muscle. There's not enough space for me to show it, but this is thicker than the screen would show. We use a portion of this muscle while it's attached at the top and tuck it in there, right? So if you were to imagine, if you were to do a cross section of this muscle, the muscle would be fairly thick. We use a portion of the muscle, so this portion, right? That's what goes here. So that muscle comes in like that, right? Contiguous. We suture the muscle. So let's use blue sutures. We'll suture the muscle to the parotid gland so that it's contiguous with each other. We lay the blue layer, the thick blue layer, on top so that it feels smooth, and then puts the skin. These two barriers prevent these nerve branches from being able to go in. They would have to go in through a muscle, which they cannot do, through this thick layer, which they cannot do again, to get to the skin. So by doing a two-layer reconstruction, not only do we create a smooth contour on the face, but we also place the barrier over the parotid gland to prevent the nerve branches from going into attached to the skin and the sweat glands, right? So let me show you what that looks like. And so here we go. So This is a video. This is a traditional parotid incision, which gives you a wide opening to the parotid gland and everything else. We modified and started using the modified facelift, and over time, we actually limited the incision. I don't even use that part anymore. I start here and go down. And by doing that, and because the skin is so flexible, I can see the nerve that goes to your earlobe, sensor for sensation, the facial nerve and the branches. I can see the tumor, so I can remove the tumor with a cuff of normal. The tumor is superficial, and use the muscle to put it in there so that I don't have a divot. If the tumor is deep to the facial nerve, I can transpose the nerve, get underneath it, and do that. So that's how we can remove these large tumors and create a smooth contour afterwards and create symmetry on the side of the face, right? You can see the two sides of the face are even. This person doesn't have an indentation, right? It's absolutely not necessary to have an indentation. So that's the reasoning for this. Now, traditionally, the way I was taught to do parotidectomy was through that larger incision, right? Those patients did need to stay in the hospital. Back then, it used to be at least 2 days of hospitalization. But now I do these surgeries completely on an outpatient basis. The patients have surgery. The next day the same day they go home. They can eat. They can talk. They can walk around. In fact, by the next morning, I ask them to go for walks around the block to get the blood circulating, get the anesthesia medicine out of their system, get their body moving again to get going, right? And I find that patients do significantly better after surgery at home, in the comfort of their home with their family, as compared to being in the clinical setting of a hospital and being bothered all night with someone coming and checking their blood pressure and so on and so forth. Now, if someone has heart disease, lung disease, kidney failure, obviously I'll do the surgery at the hospital because they need to be monitored. They have other medical issues that necessitate monitoring. But the surgery alone doesn't require monitoring, right? And so generally the patients go home the same day. They come back the next day. I do the first dressing change. The sutures that I use are all under the surface, right? And are absorbable, so I don't need to remove any sutures. I show you how to do the dressing change. I put the dressing on. You have a Velcro strap that goes all around your head to put pressure on this area. By pressing on the area of the surgery, you close and push the tissue together so the muscle flap sticks to the parotid gland, and the skin and everything on top of it, they stick together. And by sticking together, they don't allow a potential space between them that saliva can accumulate. So that pressure dressing serves a huge purpose. It also minimizes swelling so that by the time a week has passed, the amount of swelling in this area is minimal. So much so that the only person that notices is the patient themselves. Most other people won't even notice that they have had swelling or a surgery or anything else. Now, the question about reconstruction and the necessity of the reconstruction. I feel like since I can do the reconstruction in the same sitting at the same time, and by doing so, I can make the two sides of your face be even, right? And also prevent you from having a sweating issue while eating. I see no reason why anyone should have this surgery without a reconstruction. There is no downside to doing a reconstruction, right? Using a small portion of this muscle, this is the muscle I'm talking about. This is the thick muscle that goes from here all the way to my collarbone, right? Using a small portion of that muscle to go over here doesn't affect the movement. So none of my patients have issues moving their neck or stretching their neck, right? Immediately after surgery they do because they're swollen and inflamed, but a month later, once they start exercises and stretching, all of that goes away and they go back to normal. So there is no downside to doing a reconstruction, there's only benefit. So I really feel that everybody who has parotid surgery should have reconstruction. Now, the size of the tumor dictates how big a reconstruction they need. If they have a tiny little tumor, right, they'll have a tiny little reconstruction. If they have a massive tumor, they're gonna need a bigger reconstruction. So that's just it. And so everybody really deserves a full treatment and should have it because we're already here. there's absolutely no reason not to take the extra time to do that and prevent you from having further problems, further issues, and sweating and complications. All right. Hope this is helpful. I wish you guys best of luck. The world is a crazy place right now, so please get yourself informed and make the decision that's best for you and your family. Take good care. Have a wonderful weekend. Bye.